Jerry, I've been stirring things too.
That's all right. We're stirring good.
They actually send people. They actually send people home.
Waiver. I'm Sandy Ellsworth, and I work at the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. I want to introduce the people who are with me today. First of all, I have Renee Rader, who works with me at the Division of Mental Health. Andrea Kana has magically disappeared. I think she's in the lobby, but you will get to meet her in a minute. I want to thank Chris Egan, who is way in the back, and you've seen him in the registration. Chris is from DDTI, who has made all the arrangements, and these sessions would not go on without him and his staff. And I also want to thank Martha Thompson and Liberty Corners for assisting with the registration. There have been a lot of you today, and without their help, we probably would still have long lines. And I also want to recognize some of the LMEs who I have seen as they've come in. Jessie Smathers and Don Herring are here from Western Highlands. Robin Page and Sheila McLeod, I think, is here from Smoky Mountain. Jeff Payne is here from Centerpoint, and there may be a few others who I have not run into as of yet. We're here to discuss the waivers. We are talking about the North Carolina CAP IDD waiver. We're not here to talk about the BC waiver or the innovation waiver. This is the North Carolina IDD waiver. This waiver actually started in 2005. At that time, we submitted what was called a new waiver package, and it was approved for a period of 3 years. We did the same thing in 2008. We made some significant changes in 2008 because in 2008 we pulled out one of the waivers and made it into a supports waiver. So in 2008 we ended up with a comprehensive waiver and a supports waiver. This is the renewal of those waivers. Where before the waivers have lasted for 3 years, a renewal waiver lasts for 5. We're here to talk about the changes in the proposed waivers, and we're here to talk about the transition processes. One of the things that you will see is that I know we've all been familiar with calling the CAP IDD waiver, the CAP MRDD waiver, CAP MRDD. This year, a federal law called Rose's Law required that the term mental retardation was taken out of all federal statutes and programs. The waiver is a federal program, and for that reason, and for other reasons like it's the right thing to do, we have changed the name of this waiver to the CAP IDD waiver. You will see that in most of the literature that comes out, that the term intellectual disability will be replacing the term mental retardation. What is the purpose of the waiver? The purpose of the waiver is for individuals to have meaningful lives in their community. The purpose for the waiver is to be part of their community and to be active in their community. We've made some changes, some significant changes, some minor changes, and the purpose for the changes were to better meet the purpose of the waiver. To utilize the fact that the utilization of services last year far exceeded the cap budget, and the fact that we still have over 7,000 people on the wait list. Unfortunately, as some other services dwindle because of our economy, that number is growing daily. What is the waiver approval process? Once a waiver application has been completed, it is submitted to CMS, the Center for Medicaid and Medicare Services. CMS reviews the waiver, has communications with the state, and a final waiver is determined. At that time, the waiver is approved for the effective date. Nothing that I am talking about here will be finalized until CMS says it's finalized. One of the things that many people have been confused about is when you looked at policy, clinical policy 8M, people felt that itself was the waiver. In order for services to be done in North Carolina, they have to be done according to the clinical policy. The clinical policy was written based on the information in the waiver, but it is not identical to the waiver. The date for implementation of the waiver is 11/1/11. Do we expect that date to be 11/1/11? Yes. What normally happens at this point is CMS and North Carolina will work together very quickly, very diligently, and with lots of hours to make sure that everything is ready for implementation on 11/1/11. The other part of that is the existing waiver. The one we're in right now expires on 10/31/11. We have to have something in place on 11/1/11. Parents providing services. No services may be provided to a minor child by their parent, their step-parent, or their adoptive parent. Personal care and home and community supports may be provided by parents who reside with their adult participant. Parents or other individuals residing in the same home as the adult participant may provide up to 40 hours of approved medically necessary services. Let me repeat that. This is per person, per family member who is living with the individual. This is not 40 hours per family. This is 40 hours so that if mom, dad, and Some general changes. We've changed staff supervision requirements. The requirements, we've changed requirements so that paraprofessionals and associate professionals must be supervised by a qualified professional. The qualified professional must be a QP in the area of the individuals that they're supervising. For that reason, if my agency is providing substance abuse services and IDD services, and I'm a Q in substance abuse services, obviously I could not supervise somebody who is doing IDD services. The supervisor and the employer shall develop an individualized supervision plan upon hiring. The supervision plan should describe exactly what the supervision is going to entail. How often, how frequently. However, supervision has to be at least once a month. And more if the situation requires it. The supervision should be documented in the staff personnel file. We've had some questions as far as why can't we document it in the individual's record. This is staff supervision is between the employer and the supervisor, and this is not belonging in the client record. Supervision plans need to be rewritten at least annually, but of course could be written more frequently than annually. One question has been, does supervision have to be face-to-face? During a month period of time, you may have many types of supervision with your employees. At least one of those must be face-to-face. Another thing that we changed was that criminal background checks must be completed and includes no health or safety risk to the participant. Before we said that there had to be a criminal record check, but we never said what could be done, what needed to be done about it. What we are asking is that providers look at this record and see if there's any potential risk. Of course, there always is a potential risk when you're hiring people, but we want to limit it. To have the information in front of you and not to do anything with it increases everyone's liability for no reason. We added a requirement that staff are to receive person-centered thinking training, and the training will be as specified by DMH DDSAS. This has not been determined as far as how much and what schedule it will be done in. Hopefully in the next 2 months we will have it for providers. No, we do not expect you to have it November 1st. Moving into services. Personal care provides the individual with support and engaging participation.